Hi, I'm Andrew Holden from Auckland, New Zealand, and I'm very excited to present an update of the Medtronic IN.PACT AV Access trial and to look at the safety and effectiveness of outcomes through to 24 months. These are my relevant disclosures. Well, we can see from this cartoon produced actually by the New England Journal of Medicine relevant to the publication of the primary efficacy and safety data that this trial was a 330 patient prospective multi-center and multinational randomized controlled trial of 330 patients, 170 randomized to angioplasty with a paclitaxel coated balloon, the IN.PACT AV balloon, and 160 patients randomized to standard percutaneous angioplasty. The endpoints, the safety endpoint was freedom from serious adverse events through to 30 days involving the AV access circuit, and the primary effectiveness endpoint was target lesion primary patency through to 6 months or 210 days in this trial. And this was defined as freedom from clinically driven target lesion revascularization or access circuit thrombosis measured through 6 months post-procedure. Now, if we have a look at the baseline demographics across the two arms of the trial, they were very well matched, and there were no surprises. If you think of patients with renal replacement therapy, there was a high incidence of hypertension, hyperlipidemia, and type 2 diabetes. In terms of the distribution of access type, in both arms of the trial, half of the patients had a forearm or radiocephalic AV access, and the remainder had upper arm AV access, either brachiocephalic or brachiobasilic, and the distribution was even across the two treatment groups. If we specifically look at some lesion characteristics, 70% of the lesions in both arms of the trial were restenotic. Obviously, the remainder were de novo. And there was also a matched distribution of target lesion locations within the access circuit, the most common being at the AV anastomosis, at the venous outflow, and at the cephalic arch. So here are the primary efficacy results through to 6 months as published in the New England Journal of Medicine. As I mentioned in the design of the trial, we measured the 6-month window plus or minus 1 month, so we reported the patency out to 210 days. And the headline patency of target lesion patency at 6 months for the patients treated with the drug-coated balloon was 81.4%, compared to 59.0% for the standard PTA, a delta of over 22% in patency, and highly significant. This is the first time, in fact, that a prospective randomized controlled trial of a drug-coated balloon angioplasty and AV access has met its primary efficacy endpoint. You'll see not only was the target lesion significantly patent more often at 6 months, but also the entire access circuit, again, a highly significant patency difference between patients receiving the DCB compared to standard PTA. Well, it was a pleasure at the Link meeting in 2020 to present for the first time the 12-month patency results for the IN.PACT AV Access trial. And I was certainly delighted to see sustained target lesion primary patency, an unheralded primary patency of 65.3% for the DCB arm. You know, many trials at 12-month are reporting primary patencies of 20 to 30%. To achieve this was very impressive. And in fact, that sustained delta between the drug-coated balloon arm and the standard PTA arm, which I'll remind you was a high-pressure balloon angioplasty in both arms of the trial, was very impressive. Once again, as we've seen in 6 months, not only did we see sustained patency advantage in the target lesion, but we saw this for the entire access circuit. So a primary patency for the entire access circuit of 55.1% at 12 months for the DCB arm was very impressive. Now, for the first time, it's a pleasure to present the primary patency results through to 24 months. Really, there have been very few trials that report primary patencies out this long in AV access intervention because the patencies are so poor. And yet we can see a real flattening of the patency curves, as you can see in this Kaplan-Meier plot, with very little drop between 12 and 24 months, and a primary target lesion patency of 52.2% for the drug-coated balloon arm, and a very significant delta in patency when compared to the standard PTA arm. Really very impressive results at 24 months. Once again, I'm pleased to report that the entire access circuit patency was also significantly better for the DCB arm, and as we can see, the entire access circuit primary patency at 2 years now of 39.5% for patients randomized to the drug-coated balloon arm. I'd like to just now present some important safety information. You know, in 2019, there was the concern of an elevated risk of all-cause mortality with the use of paclitaxel devices in femoropopliteal intervention, and that perceived increased risk was after 24 months. Of course, with more recent information, it appears that that is largely due to trial design rather than a real problem, but we now can see freedom from all-cause mortality through 24 months in the IN.PACT AV Access IDE trial, and I'm delighted to say that there is absolutely no evidence of a mortality risk with drug-coated balloons. The freedom from all-cause mortality through 24 months is almost identical in this trial for the patients treated with drug-coated balloon versus standard PTA, so no safety concerns were seen. And interestingly, we now have an ability to compare at 2 years the two large prospective randomized controlled trials evaluating drug-coated balloons in AV access stenoses, the IN.PACT AV Access IDE trial I've just discussed, and the BD Bard Lutonix AV IDE trial. And you can see that these Kaplan-Meier plots are very different. Not only are the patencies of the DCB arm in the IN.PACT trial significantly better than those achieved in the Lutonix trial, but the delta, or the separation of the curves between the drug-coated balloon and standard PTA arms, is also very different, with, in the IN.PACT AV trial, a sustained patency benefit out to 2 years now for the IN.PACT AV drug-coated balloon. So in conclusion, the IN.PACT AV Access trial is the only randomized IDE trial to meet its primary safety and effectiveness endpoints through to 6 months, as was seen demonstrating superior treatment effect of a drug-coated balloon compared to standard PTA to treat stenoses within the AV circuit. We've seen sustained and superior performance of the IN.PACT AV DCB, not only now at 6 months, but through 12 and 24 months, with a target lesion primary patency of 52.2% for the DCB arm and an access circuit primary patency of 39.5% for the DCB arm. Very impressive figures out to 24 months, with a significant p-value in terms of patency advantage. I'm pleased to say there's no evidence of a safety issue, no difference in mortality through 24 months. And these durable long-term data suggest the use of this therapy as a standard of care for patients with end-stage renal disease at high risk of repeat interventions. Thanks very much for the opportunity to share this exciting information.